name is Rachel Holweg, and this is my dad, Mike Holweg, and we're the authors of the book Pain-Free Foods. And so we work with diverticulitis, colitis, and Crohn's clients, and we have personally coached over 10,000 clients each. Clients call us before they order a lot of times, and they have a lot of questions that they want to ask. And one of the questions that comes up very frequently is, my doctor's recommending surgery, or I've heard that a lot of people have to have surgery if you have diverticulitis. And statistically now, research suggests 1 in 3 patients that have diverticulitis will have to have surgery. And so we're going to talk about our experience with that and what our clients report to us.
Because surgery and diverticulitis are so serious, we want to tell you that we're not doctors or medically trained in any way. We have been doing this for enough years that we've actually had patients who have submitted to diverticulitis surgery, such as a partial or complete colonectomy, some of whom have the colostomy bag and have just done the whole 9 yards, and many of them actually return to the symptoms of diverticulitis after the surgery. So we're put in this odd situation of seeing where people who have actually gone through what they thought would be the ultimate sacrifice and therefore the solution to diverticulitis, and it ends up not being the case, which is very heartbreaking for them and for us as well. So we want to talk about that for a minute and kind of explain why we feel that unless you need to, and it's recommended to you personally by your doctor, that surgery may not be the solution for everyone.
Legally, we can never contradict your doctor's advice. If your doctor says that you need surgery, then we can't tell you, oh, no, you don't take our advice instead. But we can tell you our experience with other clients. And so, like I said, I've coached over 10,000 people personally, and Dad's done the same. And we've helped, based on our clients reporting back to us, we've helped tons of them avoid surgery. And so, yes, there are people that will get to a stage where surgery is definitely needed, but is that the case with everybody? With clients that we've talked to, we have helped many of them avoid surgery in the past. They've kept in touch with us. They've kept us informed on their progress. And one of the ways that you can get in touch with these clients directly and talk to some of them is our Facebook group. We have a Facebook group called Pain-Free Foods Support Group, and you can actually just look at the link on the bottom of the screen and you'll see exactly what to type in, and you can request to friend us on Facebook, and it doesn't matter if you're on our plan or not. We'll accept you on Facebook, and you can actually read what other clients that are currently on our program are saying about it, and don't just take our word for it. Read what they're saying and listen to what they're talking about, and you can actually delve into what they're doing and what's working and tips and pointers from other clients.
We're not qualified to tell you whether surgery is necessary for you or not, but I do want to take a minute and explain. Over time, a person who's a diverticulitis patient actually has a very compromised mucosal lining in their colon. In other words, the mucus that's supposed to protect the colon tissue from acid is eroded away over time through a number of reasons that we explain in other videos. Once that mucosal lining is gone, it is acid that begins to directly act on the colon lining and damage it to the point where diverticula form. There's pouches, aneurysms, fistulas, other ulcerations, and it just becomes a mess. And any doctor and any lay person can see one possible solution is to remove that section that is so damaged and causes so much pain and discomfort. Our experience, however, is that once that section is removed and they take the last remaining sound tissue and attach it back to the rectum or the anal valve. And so at that point, what used to be fresh, undamaged tissue has now been moved to that same location that was damaged before. To understand why this is not really a long-term solution, Rachel's going to explain a bit about how that tissue got damaged in the first place and why the end of the colon, the very caboose, the end of the line for the colon, is almost always the most damaged portion.
You eat your food, it goes to your stomach, and it goes through your digestive system. It'll sit at the end of the line for a while until the next time you use the restroom. So all the acid that was produced with digestion is then just sitting, waiting to come out and eating away much more aggressively because it's there for so long. Let's say, overnight when you go to sleep, it's sitting there for 8 hours. This acid digestive food mass, and it has nothing to do but work on the wall of your colon. And so what happens is that portion of your colon becomes much more damaged because it's concentrated for so long in that one area. And so we have a lot of clients that come to us after having a surgery that say, I had the surgery a year or 2 or 10 years ago, and my symptoms are back. I thought this was supposed to be a fix. And the truth is, if you don't change your diet, if you don't change what you're doing, that acid is still located in that same area and it's still causing the same damage that it was before. They've taken out the damaged portion and they've moved everything over so that you have a portion that's not completely damaged and ruined. Then that portion of your intestine is subjected to the same acid damage that the previous portion was. That's why surgery isn't always a solution for everyone. You're still eating the same, you're still going through the same process that you were before, and just removing the damaged portion of your digestive system isn't a solution because more of it can become damaged.
The short of it is this: enzyme digestion is the preferred method that does not damage any of your tissue. It doesn't strip away the mucosal lining. It doesn't ulcerate and cause diverticula to form in your colon. And so our diet actually helps a person switch a large portion of their digestive process over to enzyme digestion and eliminate that endless acid production all day long for 3 meals a day plus every time you're stressed. So that is the long-term solution. If you cannot and never will acclimate your diet to that, then yes, you need to strongly consider having a surgery once your doctor recommends that, because if you do not change your diet, you will not change your acid production. And even a new stretch of colon being reattached is going to go through the same process of erosion, mucosal lining, strippage. We have had patients after surgery come back in as little as 2 to 4 months saying they're beginning to feel their symptoms again in the same location. And again, we're not doctors, we're not trying to contradict your doctor. Do what your doctor says. Do what you and he or she decide. But consider that for many people, altering their diet is a better solution and actually can, in some cases, solve the problem. Thanks.